Denying care, the impact of the U.S. healthcare system on lives and families. The healthcare system in the United States is a complex web of providers, insurers, and government programs. It operates under a predominantly private model, making it unique among developed nations. Despite its advanced medical technology and expertise, the U.S. healthcare system leaves millions uninsured or underinsured, leading to devastating consequences for individuals and families. This documentary explores the systemic denial of healthcare insurance coverage, its root causes, and the profound impact on patients and their loved ones. The structure of U.S. healthcare. The U.S. healthcare system is largely privatized, with employer-sponsored insurance being the most common form of coverage. Public programs like Medicare and Medicaid serve specific populations, such as seniors, low-income individuals, and those with disabilities. However, gaps in coverage remain a persistent issue. Employer-sponsored insurance excludes those unemployed or working in the gig economy. Medicaid eligibility varies by state, leaving millions ineligible despite being unable to afford private insurance. High deductibles and premiums make even insured individuals avoid necessary care due to cost. The reality of denial. A significant number of individuals face denial of healthcare insurance coverage, often for reasons such as pre-existing conditions, prior to the Affordable Care Act's protections, out-of-network services, or inadequate coverage plans. The Kaiser Family Foundation estimates that 9% of all insurance claims are denied, leaving patients to shoulder exorbitant medical bills. Case studies. John's battle with denial. John, a father of 3, was denied coverage for an experimental cancer treatment deemed medically unnecessary. As a result, he and his family faced financial ruin, raising funds through online campaigns to cover life-saving care. Maria's heartbreak. Maria's daughter suffered from a rare genetic disorder requiring specialized therapy. Denied coverage on the grounds of being outside policy guidelines, Maria's family watched helplessly as their child's condition worsened without adequate treatment. Impact on lives and families. The denial of health care coverage has ripple effects beyond the immediate patient. Families bear the emotional and financial burden of caregiving, often at great personal cost. Emotional strain. Loved ones experience guilt, helplessness, and grief as they watch family members endure pain or succumb to treatable conditions. Financial ruin. Medical debt remains the leading cause of bankruptcy in the U.S., with families sacrificing homes, education, and retirement savings to pay for care. Workforce implications. Caregivers frequently leave the workforce to provide support, further straining household income and stability. Quote, "My husband's cancer treatments were denied, and we had no choice but to sell our house," shares Linda, a widow who lost her spouse and financial stability within a year. Systemic inequities. Access to health care is disproportionately affected by socioeconomic status, race, and geographic location. Low-income individuals are more likely to lack coverage due to Medicaid restrictions in non-expansion states. Racial minorities face higher rates of denial and systemic barriers, resulting in worse health outcomes. Rural residents struggle with limited access to providers and higher rates of uncovered services. The path forward, reforming the U.S. healthcare system, requires addressing its structural flaws. Expanding public coverage. Programs like Medicare for all or universal health care systems could ensure comprehensive coverage for all citizens. Strengthening regulations, enforcing stricter oversight of insurance denials, and ensuring coverage of essential treatments. Reducing costs, negotiating drug prices, capping out-of-pocket expenses, and investing in preventive care. Addressing social determinants, improving living conditions, education, and access to nutritious food to reduce healthcare disparities. The denial of healthcare coverage in the U.S. is more than a policy issue. It is a moral crisis affecting millions of lives. Families face impossible choices between financial survival and the health of their loved ones. As the nation debates the future of healthcare, prioritizing equitable access and comprehensive coverage is essential to prevent further loss and suffering. This is not just a healthcare issue, but a human one. Call to action. A system that denies care denies humanity.